All right, that's where it hurts.
Got it. That was good.
We're not scratching people today. Behave.
Got it. I'm delighted to have Charmer here today, and Maya is the owner and guardian and mother of Charmer.
Charmer is 15 years old. He is a domestic Shorthair, though I suspect he has some Siamese in him because he's very vocal. He also, 2 years ago, was diagnosed with a cancer that is actually considered rare for cats. Dogs get them. It was a mast cell tumor on his ear, and as you can see, a little piece was actually removed during surgery.
And when was his surgery?
So surgery was 2 years ago now.
And did he have any equilibrium issues or vestibular issues?
Yeah, so
where he drunk walk, losing balance?
Yeah,
and when I say drunk walk, that's how it's described medically, where, and it happens to humans or animals, but you have such disequilibrium that you walk like the cartoon drunk.
Yeah.
You know, and you've seen that before, right?
Mm-hmm.
So I'm going to check him head to toe if you let me.
Okay. And please.
If he gives me permission as well. If he gives me his consent.
I noticed he's has lameness in the left foot.
Okay.
I would do this, and of course he's not doing it now, but you would see him twitch.
Yeah.
Like this, just an indicator. Now, if he's wants food, he'll put his tail up like he usually does. But I noticed that when he walks, he kind of, with his butt under him a little bit. And with smaller steps, not those nice long strides that they take.
And that certainly can happen, and that's why I do like to check the whole body. And even when if the symptoms are down into the paw, we do want to check upper cervicals, because just like humans, you know, you have an upper cervical issue or lesion or herniation, or even lower cervical, and you can get numbness into the hands or weird sensations.
He complains. If I'm, wiping him off, he'll complain about me touching his tail, which isn't something he used to do. So that's why I think, that there may be.
And hopefully he gives me access. So Charmer is his name, right?
Yes.
It's a cute name. Hi, Charmer. Is it okay if we work together a little today? What do you think about that? I always like to ask. It's always good to ask. Okay. Do a little work today. The cool thing about cats, since they're so flexible, is you can work really soft with them. So I'm up here at this C1 right now, and I'm feeling for the wings of the atlas, and they're much smaller than on a dog. The first thing I noticed is C4 on the right is out, so I'm rubbing that here, really soft. But here you can feel this too, so soft as you can go, touch right there. It's just a big old knot right there. No, go softer and slower. So it's right in there.
Oh, I feel it.
Yeah, so we're going really soft. So first I'm going to massage this out. I made a course called How to Massage Your Dog, and there's a website called howtomassageyourdog.com. And I've been wanting to do another course, a follow-up course called How to Massage Your Cat. I even got the domain already.
Oh, really?
So I have it. I just have to do the course. But you could almost use the dog course for the cat course, because it's very similar of the technique and what I would teach. But so here's a spot that I'm going to do some of that technique. And so I'm going to first do some sustained pressure on that muscle, and it has to be very gentle. So it's about the same amount of pressure that if you had a grape on the kitchen counter, a single grape, and you put your fingerprint on it to dimple it.
Okay.
But you don't want to break the skin.
Correct.
So that's enough pressure.
Okay.
Because if you went further than that, you would crack the skin on the grape, right?
Yeah,
and we don't want that. And I'm just massaging over and over in that spot, and I'm going to do a little bit of a release now. So I'm going to... Got it.
Oh, wow.
Nice. So that's a C4. Charmer, you listening? C4 adjustment on the right. And you can see it's gone now.
Oh, yeah.
Is that cool?
Wow.
Good. And it seems like he's okay with that. And now I want to do the atlas next. Very often I start with the atlas. So this, look, here's the right atlas is no problem, but the left atlas he squirms away because it's sensitive. And that's
It's all right.
super sensitive here.
Yeah.
So I'm going to just hold that for a second. And I'm going to do a little flick. Got it. That was good. I could feel that click a little bit.
Yeah.
So that's that.
Being so good.
Let me feel it. Yeah, so that's nice. So the space is back. It was a little wedged up against the occiput, and that can affect the front left paw, so that's good. Now we're going to come down into the lower cervicals on the left side. And may I touch your shoulder so we come closer to you? I'm in this area here. Sweep your hair away for us, okay? So I'm now down in here.
I know. Yeah.
Okay, this
I'm
whole
a mess.
section. So this area is going to innervate all the way down here.
Okay.
So here I am at C7. So I'm in the lower cervical area, and I'm going back and forth, kind of working on this. And I do find a bad spot here. And so I'm just going to do some sustained touching and massaging. And I'm working through this trigger point. So he has a trigger point, which is an excessive muscle knot. And it's kind of interfering with his nerve flow down the front left extremity. In this case, it's his shoulder. So here's the shoulder blade. Then we get into the humerus and down the radius and the ulna and the cute little paw. And he's letting me have access, which is so nice. And now we're going to go back up to the problem area again. So I think it's all coming from this neck. So I'm working in here, and I think you'll see a big difference of the way he responds within 24 hours. So here's a bad spot right there. And I'm going to just do a little bit of adjustment now. May I get this for you, Charmer? Okay. All right, take a breath, Charmer. That was a good one. Are you amazed that he's letting me have this access? Hi, what are you thinking about?
It's actually a beautiful
Okay,
thing.
now we're down here. Okay, that's your thoracic. So dogs and cats, well, all mammals except sloths and manatees have 7 bones in the neck. So we all have 7 bones in the neck, so whether you're a giraffe or a cat or a dog, all mammals do. There's a big variation in the thoracics, like we have 12 in the rib cage area, and they have 13 and 7. Dogs have 13 and 7 too. Horses have typically 18 and 6, depending on the breed, but for the most part, you're going to find 18 and 6. And pigs might have 15. It depends on the breed. But so when we're down into the lumbars, we're looking at 7 lumbars. A big critical spot in these quadrupeds is the thoracolumbar junction. So it's 13 to L1, and that's the spot that he notices.
Yeah.
So when I'm on this, he squirms, and I'm barely touching it. But I'm going to give it a little mobility. Like I said, the cool thing of working with cats is you can work soft with them. And he's kind of working with me because he can push up against me and kind of lead me. There's no rush because I can move this with, there's a whole technique in human chiropractic called DNFT, directional non-force technique. So I'm able to do a correction in this. Now I'm right on T13L1 junction without having to like traumatize him to get it done. And he knows I'm on it. He's kind of squirming away from me a little bit, but he's still giving it to me. And I'm working it until it gets a release. So I've already taken the slack out, and I'm going to just impulse really quick.
All right. Good boy. Good boy.
That one cracked. So that was a little pop.
I heard a little bit.
All right. So that's
A little
good.
bit of a growl, but that's good.
Did he growl a little bit?
Yeah.
Yeah. Charmer, what do you think? Can we do a little bit more? Because I want to go down to your pelvis now. Now I can feel the tuber sacralis, which is the big landmarks on the ilium where it meets the sacrum. I don't know if anybody can see these. You can.
All right, that's where it hurts.
That's your bad spot.
Okay, buddy.
We're going to let him settle down a little bit.
We're not scratching people today. Behave. Okay? You're doing so good.
I might just do a quick adjustment with this because it's so fast and light, and then I can just be done.
All right.
So I'll get between, and it's just
Alright.
one adjustment. Got it.
Good. I know. All right. Okay. Oh, buddy. I'm sorry.
Okay, that's the tail.
Now we're not doing that.
So tail would probably be better doing another day. But we're done now, so I got it. I got the sacral base posterior. Let me feel if it's back in.
Okay.
Yeah, it's perfect. Now he's going to need a day or two to calm down as far as the adjustment goes. I don't mean personality-wise. I meant for him to integrate the work that we did today. We'll see really the extent of it in the next 24 to 48 hours. All right? Listen, thanks for letting me work with you today, okay? I'm all done. I'm not going to do any more. But you let me get in there, and I appreciate it. Do you want to walk around a little bit? Can we put you on the ground, or you want to be on your mom's shoulders?
Oh my goodness, look at that. So the limp is actually much better because it was getting progressively worse, and that was my concern.
But you see his gait. His gait is cold.
I'm telling you. And his back legs, remember I told you, his gait in his back legs was getting shorter and shorter.
Right, because he was guarded.
Yes.
Oh.
Yeah, the limp's gone.
Oh. Nice to connect today.
It got.
All right, so I'm glad you came in today.
Me too.
Yeah.
I'm so very glad. I want to combat that perhaps having less irritation.
Yeah, it'll be easier
in
to
that
do
area
more.
would make it easier,
Yeah.
and not only that, the fact that he trusted you to begin with, that's a huge
Yeah.
yes.
And it's good to end on a win.
Yeah.
You know,
I'll take it.
and so it's nice.
It's so good to not see him limp. It's
nice.
been like months of limping. It's a pleasure. Thank you so much.
All right. I'm going to just impulse really quick.
All right. Good boy. Good boy.
That one cracked. So that was a little pop.
I heard a little bit.
All right.